Good morning, and thanks for inviting me to this conference. I think it's the second time that I come to this conference. I love coming to Ireland, especially when it's about very relevant topics. And since the clock is running, I will waste no time and dive straight into the heart of the matter. I know very little about Ireland, and I'm not a specialist in the details of the topic of today. So, what I will be doing is to give you an overview, a framework within which I hope you, as specialists, can think about the highly relevant issues that are on the program today. I think it's important to start from the macro perspective on the environment and climate side, and this is it. From 1970 to today, every bar is a year, the redder it becomes, the more climate change we see. And for those who are still doubting, not in this room, of course, we are now 1 year running above the 1.5 degrees. So this logic of keeping the 1.5 alive, good luck, it's gone. Yeah. In fact, we are above 2 degrees on continuous days at some moments today. But this is the lesser known graph. It's the same graph. The grayer it gets, the less biodiversity and the less health in our ecosystems. And of course, as Laura has said already, the two are interconnected. Not only to the extent that climate change is putting more pressure, is this better? All right. I sometimes wonder how they did it in the cave times when they were also speaking. Anyway, this is not a lecture about cave time health issues. So the climate change is putting pressure on ecosystems, and we will need strong and resilient ecosystems to deal with climate as well. And we as human beings depend on these two for our own health in many ways. A lot of the knowledge at the global level comes from these large assessment panels. You all know the IPCC, of course, and I hope you know the IPBES, the Panel on Biodiversity and Ecosystem Services, health being a major ecosystem service. The third one is much less known. It's the International Resource Panel, which looks at our resource use in the latest Global Resource Outlook Report 2024, which was presented at the United Nations Environment Assembly in Nairobi just a couple of months ago. There is a big part on health and health impacts of our resource use. And of course, the World Health Organization, which brings this knowledge to the health perspective. And if you've listened to Maria Neira, I mean, she is by far the best spokesperson on the planet for that. All of these panels say, in essence, the same thing. We're living in times of urgency. We are in a pivotal decade. Secondly, we are already seeing irreversible damage also to human health, by the way. Thirdly, we are starting to see tipping points, not only in our Earth systems, but also in social systems. We start to see tipping points. India today is experiencing 50 degrees temperature. It is causing tipping points in social systems. Kids don't go to school, hospitals are overburdened. Those are tipping points. Yeah? And unfortunately, they're all connected. And of course, health is one of these connecting topics. The SDGs, as you know, are the response to this. SDG 3, good health. This is a social part of the SDGs. That's how it is considered. So it has connections with all of these other SDGs. But we by now understand much better that it also has a lot of connections to the natural capital dimensions of sustainable development goals. Why do I add again to the slide? Because of course we had SDGs in 1992. It was called Agenda 21 after the Rio conference. If you reread that text and you modernize the language, you have the SDGs. We were less sustainable in 2015 than in 92 when we reformulated them. So we lost one generation, and now we're at a place where urgency is much more relevant than it was before. Health, environment, climate, biodiversity has become a topic in academia. There are journals on it, but this one, I think, is the important one for this conference also, and a bit the forgotten part. Nature is our greatest source, not only of health, but also well-being. And that's the title of this conference. So it's a very relevant work to look at. if we take that seriously, we need to start to reframe and rethink our current society in terms of organizing it within planetary boundaries. Yeah. Now, the problem is that by now we are exceeding 6 of the 9 planetary boundaries. So it's no longer a case of not exceeding them, but of returning to them. And that is this great transition, systemic transition that we are facing. And to put that in the social perspective, you all know Kate Raworth's donut economics, I suppose. If you look at health, which is a central part of it and interconnected to many other things, that's the big challenge, I think, in terms of the conference that you are discussing about today. Yeah. The One Health perspective, which will be discussed more in detail this afternoon, is one way of grasping that in a particular way. The one thing I don't agree with in this representation, but it is the standard representation, is that it doesn't take the environment and Earth systems as the boundary condition. So it suggests that you can have these endless trade-offs, whereas it's rather foundational. You need strong natural capital to build healthy societies, for which you need an enabling economy. Unfortunately, we tend to turn that around, but that's a bit the bigger picture. This whole idea of working in this systemic way is also leading to new alliances. And in the introductions, you were also pointing at collaboration and new alliances. Also at the European level, the agencies that work on health, environment, chemicals, animal health, they are working together now on this topic. So this is also a challenge for knowledge communities. Good. If we now look at the nexus issues here, this is a bit the framing that is now used by people who work in human ecotoxicology and in the understanding of the linkages. And genes load the gun, the environment pulls the trigger, where we are living in a better understanding of our DNA and of what can go wrong there, and what is endemic and endogenous to our own constitution, but also the burden of disease project that is illustrating how much is actually coming from a variety of environmental pressures, behavior, all the things that were referred to in the introduction when talking about older people. They've been exposed the whole life to all of these issues. So this is what we are working on. This is what Laura mentioned. If you look at non-communicable diseases and the impact of environment on them, if you look at the European level, these are numbers and data from the EEA, cancer, heart disease, pulmonary disease, brain, metabolism. Well, there's not much left being a non-physician. I mean, if it's heart, brain, lungs, metabolism, that about covers most of what I'm representing here. So, I mean, it's having an impact on all of these issues that is rather pervasive. If you look in more detail, for example, in cancer, typical male cancer, testicular cancer, look at the increase because of endocrine disruptors, and you also see the difference between countries and their level of economic development, because the graph goes to 2000. Yeah? And if you look at breast cancer and how it goes up, endocrine disruptors, I mean, this is evidence from science that these things are indeed strongly correlated, if not there is causation there. Yeah? Sperm concentration decrease. This is from a number of studies that they have revisited and with statistics worked on. We see a very significant decrease in sperm count, and this is of course having an impact also on the healthcare system and on procedures that couples go through or individuals go through. So this is another type of proof. A lot of this connection between environment and health issues came to the forefront, I would say, at the European level about a decade ago. I remember the first time when I met Laura, that was in Berlin. We met, and I was new in my position as the head of the EEA, and Laura wanted to talk to me, and she said, "You are going to pay more attention to health and environment issues, are you?" And of course, when Laura says it, the only thing I could say was, "Of course, I will do that." So with the agency, we actually have been doing that, and I think this is the most explicit and visible result of those efforts. We now have an online. I still say we. I shouldn't do that because I've been gone for a year there, but I can't help it. We still have a lot of work to be done, but there is an atlas now online where you can go to a place in Europe, you click there, and you get the health information, the environment information, and social distribution information. This is really interesting because it speaks to this interconnected nature of the issues that we are discussing. And just to illustrate, this is not from the 1980s and the Iron Curtain, but it is the health and environment Iron Curtain in Europe, where you can look at premature deaths caused by the environment, and you see Eastern Europe, where a lot of this has to do with energy poverty, with the fact that they're still burning coal and dirty wood in house environments, where there's a legacy of pollution that is still rather large. So this is important information if you want to steer at the European level. One thing that I think is really important is to involve citizens in this debate. And I think citizens are increasingly not only concerned, but also involved. Yeah? Air pollution is improving, by the way, which is why we see this downward graph in premature deaths. But citizens play a critical role in that. And this is from a project that emerged in Belgium, but that is now also taking place in Ireland, where citizens are measuring the air quality where they live, yeah, or where their kids go to school. And that makes a connection, because I think we make the mistake as people who are knowledge actors who only think that we need to explain better to citizens. I'm convinced that we need to speak with citizens and not only to citizens, and even better involve them in creating a joint understanding of the issues where they live, where it's connected to their life, because it shifts the needle on the compass in terms of engagement, in terms of community embedded discussions, and that can really happen. This is on air quality. I said at breakfast to some colleagues, the same club in Belgium also developed a dagger that you can put in your backyard, not in some nature reserve, in your backyard. And through the Internet of Things, it transmits information because there are monitoring devices in it. And we also now have a better understanding of what is happening in your backyard. Yeah? So if you start to connect that, citizens are engaged, involved, and you change the politics in the debate. Yeah? This is the European climate law. That's what they always use. It has a link with health that's explicit in the climate law. That has led to a European site that brings together the best knowledge on climate and health issues, where you can find evidence and data, but also the policy context. You can find all sorts of map viewers and data explorers, and you can go to deeper studies like this one, where climate change is connected through causal thinking with cardiological issues. Yeah? And this is the reason why that is important, because vulnerability, more and more people in Europe are exposed to heat waves. That's the line, yeah, 200 million every year now. And this is why that is important. If temperature goes up, daily maximum temperature, this is in Brussels, look at the premature deaths. in the Brussels environment. I mean, if you ever wanted to teach statistics, this is about as strong a correlation as you can find. Yeah? It also causes all sorts of impacts, climate change. Laura mentioned that. The EA also did a really good report on that, focusing also on inequalities and on how people can deal with that, and on how in urban spaces we can deal not only with the problem, but create benefits from dealing with the problem, reduce inequality and maximize health and well-being benefits. And especially if we involve local communities. Now, that is not the strength of most countries' public policy making involving citizens. So this is a challenge to highly institutionalized procedures. Nature restoration, it was mentioned already. Why is that important? Well, first of all, nature has been giving us early warnings about the impact of, for example, the use of chemicals. But we also know that indeed it can be a force for good, co-benefits of issues and green spaces in cities. Why is that important? Just one example. Attention, reaction time measured in teenagers in these tests that they do, the more green space, the shorter the reaction time. You know, green space does something with our brains. So this is important. What is important is it's about high green, not low green. Yeah. So there is a reason to invest in green spaces where close to schools, close to urban citizens. And that's where the 330-300 rule comes from. Everybody should see 3 trees from where they live. And there should be 30% tree canopy in urban environments. And we should be 300 meters away from a park. Yeah. It's simple, it's cheap, it's a no regret policy. Yet most mayors in Europe, because of spatial planning, which is I've called it the brothel of local politics one time. I would never repeat that, so I didn't do that today. But I mean, it's really difficult to do that. Yeah. Okay. Farm to fork. I will not say much more about it because there will be people talking about that. On chemicals and no pollution in Europe. This is very central to our health, but common sense seems to be gone when farmers are on the street, because this was turned back in a heartbeat by the European Commission, by European countries. And honestly, from a science perspective, it makes no sense. Yeah, I understand the politics and the logic of it, but it makes no sense. I will not go into that, but if you look at many of the issues we are dealing with, they're based on the use of chemicals, often in our food system, which is why also the EEA and the Chemicals Agency came with joint work on a framework for chemicals based on human health issues. Important, look, policies work, yeah? No, policies work. If you phase out certain phthalates, you see them disappear in people's blood samples and urine samples. And then we substitute them, and we substitute them by changing one little connection in the molecule. Of course, they have the same characteristics, and you see that going up. So we need a different approach to our chemicals regime as well. Important is that we are talking about the exposome here. Yeah? We are exposed to all of these things in our life, and we will need to deal with that along the lines of what you were talking about. Much more to be said about it. About your own sector. Yeah? If we want to save elephants in nature, what are the elephants in our own room? Yeah? One of them is a climate neutral healthcare system. I know somebody will be speaking about that today. Ireland is here. Estimated 6% of your emissions come from the healthcare system. How are you going to become climate neutral? Yeah? Are you going to be agents of change? If you're a health professional, you are the most trusted person in society. Yeah? According to these research results, what is your role in this? And why are you not doing it if you're not talking about this to your patients? Is it time constraints or lack of knowledge? What is it? It's a challenge to this community. Flood-prone healthcare infrastructure. Ireland, you are about at 7-8% is in flood-prone area. Yeah. And then the last point I wanted to make is that we live in Western European welfare states that are under pressure. Yeah. Why are they under pressure? Because the assumption of our welfare state was that the cake gets bigger post World War II, and we divided and invested in healthcare and in social services and all of that. But the economy that was the basis for that was unsustainable. So the big challenge is to move to a welfare system in an economy, I will skip this, that is indeed a sustainable economy and still delivers these same services. This is a really big challenge. Very few people are thinking about that. I don't know whether the ESRI is thinking about that, but very few countries are linking these two scientific communities. It looks a lot like Kate Raworth's model, by the way, so there is some thing to be had there. Last slide, I'm 1 minute late, I know, is the following. There is recent research that looks at the macroeconomic impacts of climate change. Serious research. Best modelers in climate, best modelers in economics, and they look by mid-century at the damage done to our economy. And they estimate that about 20% of the global GDP will be lost. Yeah, will be lost. Ireland is in the range of -5 to -10. Every public policy in every Western country is based on the assumption that our economy will keep growing and that GDP will grow. If this is not the case, how are you going to organize healthcare? How are you going to organize a welfare state? And how are you going to finance the transition? It costs 7 times more to be inactive than it costs to go through the fundamental transitions we need to go through. And that means in the end, it's a matter of political choice. It's a matter of values and ethics. It's not a matter of ppms and micrograms.